It includes 6 countries: Albania, Bosnia and Herzegovina, Kosovo, Montenegro, North Macedonia, and Serbia. In each country, we work with one economic research think tank. You may be aware, but this project is a capacity building project and focuses on producing evidence on the socioeconomic impact of tobacco consumption and tobacco taxation. When we started the research in this region, there was hardly any evidence in this area. However, also what we noticed was that there were no comparable estimates on smoking prevalence among adults. You may be aware, the only evidence actually, the only estimates were based on the household budget survey, which as you may know, have many limitations. As you know, CDC and WHO have been conducting a global adult tobacco survey in about 40 countries around the world. However, in these countries, GATS has not been yet conducted. So we saw value in conducting this survey in this region, and based on the amount of very relevant information that was collected, that especially for the policymakers, I feel comfortable saying that this was a groundbreaking work in this region. The survey was conducted in the last quarter of 2019. It included adults from 18 to 85 years of age. The sample was nationally representative in each country based on the latest census. 2,000 adults in Serbia and 1,000 adults in each of other 5 countries. The questions included questions on smoking status, smoking intensity, type of tobacco products the smokers use, some information on smoking initiation and cessation, exposure to secondhand smoke, and some information on economics of tobacco, such as spending on tobacco products. In addition, the respondents were asked to show the last package of the manufactured cigarettes and hand-rolled tobacco. These 2 products were selected given that they are the most commonly used among smokers in this region. Based on this last purchase pack, the information from that pack, such as place of purchase, price, information on the tax stamp and health warning label, it was possible to estimate the size of illicit trade in each country. Each presenter today, each think tank will present only the main findings from this survey, unfortunately giving a very limited time. However, more details you can read in their reports, fact sheets, and policy briefs. And at the end of the presentation, we will provide links for these documents. At the end of the presentation, the last presentation will be delivered by Dr. Frank Chaloupka, who will summarize the results from the Cigarette Tax Scorecard, focusing on this region. Now, given that time is limited, each presenter will have about 5 minutes, and I, as a moderator, will be making sure that they stay on time. A couple of other housekeeping details is that all attendees will remain muted throughout the meeting, and we ask everyone to please share your comments and questions in the Q&A box. At the end of the meeting, we'll have about 10-15 minutes when the presenters will be able to answer your questions. If any of the questions remains unanswered, we'll try to answer them over email after the presentation. However, now before we proceed with the think tank presentation, I'll first like to ask our colleague, Jeran Ozer from the World Bank. She's the senior economist at the World Bank who works on taxation for health and some other areas in public policy and governance. And as our discussant today, I'd like to ask her to share a few remarks. So Ozer, please go ahead. Thank you.
Thank you, Violeta, and thank you to the Tobacconomics team for excellent work and all the contributors. I can see how much thoughtful work went into this. Thank you for giving me an opportunity to provide some remarks to start us off. Tobacco use is one of the major risks for non-communicable diseases. We all know that the rates of morbidity and premature mortality from NCDs have been rapidly increasing, and this has enormous and very complex implications on the global economy. I'm particularly worried that NCDs affect people at a younger age in low and middle income countries thereby depriving them a greater number of years of life in good health. Also, given the current pandemic context, we know that smoking is an independent risk factor for COVID-19. Reductions in conditions associated with tobacco use will also relieve an overburdened healthcare system, assisting in a system-wide recovery for the pandemic. So, tobacco taxation, really relevant. In fact, World Bank Group, Europe and Central Asia region has been realizing the importance of tobacco control, reduction in alcohol and related risks, that they have expanded the human capital index to include these risk factors. But let's go back to tobacco taxes. They improve health outcomes, and they also help raise revenue in the short term, decreasing societal impact of future waves of the pandemic. There is an enormous body of evidence showing the negative impact of tobacco consumption on health and economic development, very extensive and convincing evidence from various countries. The Tobacconomics team receives a lot of congratulations on that regard for generating such evidence, amongst with others like WHO and World Bank and others. I believe the scorecard is an enormous contribution to the field. It allows us to have systematic and evidence-based, analytically and conceptually well-grounded dialogue between macrofiscal and health authorities. One of the gaps we see and potential for improvement is dialogue between ministries as they are instituting and considering reforms. There is a risk out there that Ministry of Finance doesn't engage Ministry of Health, vice versa, when they are considering tobacco taxation. So having a systematic tool to help support that dialogue, the evidence that the scorecard provides, I think, is enormous. Our colleagues will be presenting a lot of fascinating evidence during this webinar. I just want to share a few of the insights that struck me most from reading the scorecard pertaining our region today. Survey of smokers from the 6 countries that we're discussing today. I was really struck by the really high rates of smoking prevalence, almost 38%. And that on average, smokers consume 15 cigarettes per day, spending close to sometimes 20% of their monthly household income on cigarettes. Still, in many of these countries, cigarettes are very cheap, and then very early daily smoking initiation rates. What is upsetting is also learning that very small percentage of smokers are trying to quit, they actually claim health-related reasons and price increases as the main reasons for trying to quit, also showing the importance of our work here. I was also struck by the exposure to secondhand cigarette smoke being really high for the countries that we will be discussing today, almost 82% in Bosnia-Herzegovina. As a daughter of the region, I really feel, it resonates with me, these results, I get it. I'm from Turkey originally. There were also fascinating insights on the illicit trade of tobacco and the survey of smokers coming from that. Illicit trade of tobacco in 5 SEE countries on average came to almost 18% in Montenegro. And then it was lower in Kosovo, but 33.4% in Bosnia-Herzegovina. The survey found that main source of illicit trade in the region focuses on the hand-rolled tobacco. And there were many other interesting insights. I'm really mindful of the time, so let me stop there. I think Tobacconomics Cigarette Tax Scorecard shows that there has been some progress in tax policy design, but there's still a lot that can be done. I feel that the scorecard is an enormously useful tool in assisting tax policy design, also finding gaps and weaknesses in tax administration as an initial point. I very much look forward to hearing also from the other presenters as well as the Q&A. Thank you for this opportunity, and let me stop now. Thank you.
Thank you, Jen, and thank you so much for your comments. So as you said, in interest of time, we'll just proceed with the presentation. So the first presentation today is from Montenegro. Our partner think tank in Montenegro is Institute for Economic Sciences in Podgorica. And our today presenter is Milica Kovačević, researcher from ISEA. So Milica, please go ahead.
Thank you, Violeta. I would like to greet you all on behalf of the Institute for Socioeconomic Analysis and to thank Tobacconomics for this opportunity. As you can see, the smoking prevalence in Montenegro is very high despite the adaptation of the tobacco control policies. It is 40.2% for men and 40.7% for women. The majority of smokers report smoking manufactured cigarettes, nearly 50% of them. Most current smokers in Montenegro are actually daily smokers. They are smoking on a daily basis, around 50% of them. As you can see, the prevalence of daily smoking is especially high among adults up to 65 years of age, but also our survey shows that it is very high also among smokers with a secondary level of education, those in the southern region, as well as within those in the rural area of Montenegro. As you can see, smokers start smoking daily in their early ages, since 55.7% of them started smoking daily between the ages of 18 and 24. The problem also is that 1 in 4 smokers started smoking daily before they became adults, before they are 18 ages old. So another data that actually proves that we have problem with smoking among young people is that almost 1 out of 5 smokers try their first cigarettes before they turn 16, and that half of ever smokers try their first cigarettes before 18 years of age. That is actually showing us that we must improve our anti-smoking policies, and that they should be focused on prevention, health programs in primary or secondary school. The intensity of smoking is also very high in Montenegro. Smokers smoke on average 19.7 cigarettes per day. It is almost 1 pack per day. Men smoke more than a woman, and smokers spend an average 11.4% of their monthly household income on cigarettes, and again, men spend more than women. Most smokers use cigarettes cheaper than the average price of 1.82 euros per pack, and although the average weighted price has risen 3.5 times since 2010, cigarettes price of Montenegro are still low when we are comparing to the EU average, but still most adults in Montenegro think that cigarettes are expensive or very expensive. Next, please. What is problematic, what was mentioned before, is that only 10.9% of smokers tried to quit smoking, but they were not consistent with that decision, since 2/3 gave up during the first week, and 18% did not abstain even a day. The reasons...
Only 1 moment.
Yes, the reasons why they quitted are health-related, economic, or smoke-free legislation. And again, what is problematic is the very high exposure to secondhand smokings at home. 87% of adults allow smoking at least in one room, and it is problematic that children are exposed to secondhand smoking as well. And our research also showed that 26.8% of smokers changed smoking behavior after the last price increase, and it shows that we should continue with significantly increase the prices of tobacco through higher excise taxes to reduce tobacco use, but price increases should be combined with other non-price measures, and we should continue to reduce the gap between the price of the most expensive and the cheapest tobacco brands, and our government and the ministry are working on it, and we hope that situation will be better in the future. And I thank you again, and I stay on your disposal for your questions during the discussion session.
Thank you, Milica, so much. This was very efficient, 1 minute.
Thank you, Violeta.
So next presentation is from Kosovo. The think tank we're working with in Kosovo is Democracy Plus, and our colleague Desnik Prekazic, who is the researcher at Democracy Plus, will be our presenter today. So Desnik, please go ahead.
Okay, thank you very much, Violeta, and thank you everyone for joining, and especially UIC for making this meeting possible. So as everyone in the region, we were also part of this survey that basically has been conducted in the year 2019, and the reports that we produced last year. So I'm gonna just show you quickly some of the main findings of this survey regarding the prevalence and some of the other important findings that came out of these analyses. In Kosovo, 36% of the adults older than 18 years are smokers. Out of them, 47% of men smokers are daily smokers, whereas 21.7% of current smokers in Kosovo are daily or female current daily smokers. So the difference between male and female being daily smokers is almost almost 2 times more for men compared to women. Another important aspect is that most of smokers in Kosovo start smoking before the age of 18, and 45% of them start at the age between 18 and 24 years old. The number of, or the percentage of current smokers who tried to quit smoking during the past 10 months or past 10 months at the day that they were interviewed, only 16.1% of them tried to quit, but they were unsuccessful on their attempt. And most of them, or 81% of them, did so for health reasons. So other reasons that were listed in this questionnaire were not important for the smokers in Kosovo, but when it comes to health, most of them tried to quit smoking. Then more than half of adults, they're exposed at tobacco smoke at their home, while 9 out of 10 in bars and nightclubs, and 7 out of 10 in restaurants. So despite having this law that prevents people from smoking in open areas or public areas, still the percentage of those saying that they are exposed to tobacco smoke is still high. I have received a message that I don't have much time to go through all these, but I'll try to be quick. So actually, smokers in Kosovo spend around 20% of their budget in tobacco, which is very high. Prices in Kosovo are very low, but still from smokers, they are perceived as expensive. And according to the studies that the study that we conducted in 2018, one successful policy to prevent or to reduce tobacco smoking is tax increase. If you can pass on the next slide, Violeta. So I go quickly also. So the second report was about the tax evasion, and 8.9% of current smokers in Kosovo purchase illicit cigarettes, which is 5.8% for manufactured cigarettes, and 83, or almost all the hand-rolled tobacco in Kosovo is purchased, consumed is illegal. But we have to be mindful that the sample size for hand-rolled tobacco smokers was very small. Only 14 respondents declared that they smoke hand-rolled tobacco in Kosovo. And on the right-hand side, you can see this this chart that shows
Besnik, we cannot hear you.
Purchase, and basically in Kosovo, most of the illegal or illicit tobacco is sold at legal points of sale, which shows that the problem here is not with the prices per se or the tax policy, but it's more a failure of our state institutions to collect the taxes. If I can carry on, or I should stop here.
Sorry, I was just about to tell you that unfortunately time, I mean, we have so much material to cover, so so if you can just summarize, please. Okay, so let's move on to the next presentation. Albania. The think tank we're working in Albania is based in Tirana. It's Development Solutions Associates, and our presenter today is Aida Gjika, the researcher from DSA. Aida, please go ahead.
Thank you very much, Violetta. On behalf of Development Solution Associates, I'd like to greet and thank you all UIC team for giving us the opportunity to present our results. Well, moving concretely to the results, they indicate that approximately 1 in 4 adults in Albania currently smoke tobacco, and the average number of cigarettes smoked per day is around 16. And as you see here from the first figure, the majority of them are smoking on a daily basis, 91.9%. However, what should be highlighted from our result is the strong gender differences. It seems that there is quite a big difference between the smoking prevalence between men and women. And as you see here, and you may compare it with the other countries as well, you see that it's quite striking in the case of Albania. 42.8% of men currently smoke compared to a small number of women. Moving to the spending on tobacco, it seems that 4 in 5 current smokers spend up to 20% of monthly household income, which is considerably significant when regards to the low-income households. When moving to the age at initiation, again, there is a strong differences in terms of the age at initiation between male and female. More precisely, it seems that males start smoking before compared to females. You see here the majority of men start smoking before the age of 18 compared to women, which starts later, more precisely after 25 years old. So the majority of them, like 53, half of them, 53.5%. As moving to reasons why they quit smoking, it seems that the health-related reasons and the price increase are the 2 major factors, or the 2 major reasons why they smoke less today compared with the previous period. As mentioned in the previous presentation in the previous countries, it seemed that exposure to secondhand smoking remains problematic. Although Albania has quite improvement and quite a progress in terms of legislation by banning smoking in public places, there is still problematic, especially in bars and nightclubs, and even at home, which shows there is quite low awareness of negative impact. When moving to tax evasion, the next slide, actually, we will see that on average, 19.4% of smokers in Albania use illicit tobacco products. However, As you might see from the figure here, it seems as there is quite a big difference in terms of place of purchase of these packs, whether they are manufactured cigarette or hand-rolled cigarettes. More precisely, the majority of the hand-rolled cigarettes are bought on the street, on the open market from independent individual sellers, which shows us and indicates that there is quite a big evasion, quite a large figure in terms of the evasion in the hand-rolled packs, compared to 5% of manufactured cigarettes. When moving to the market share of illicit cigarette, namely smoking intensity among smokers who use illicit products, we show that the results show that around 30% of cigarettes are consumed in Albania are illicit. And again, here is a difference, quite a big difference between the hand-rolled cigarette and manufactured cigarette.
I'm sorry to interrupt you, but can you just please?
Yes, thank you. Thank you very much. And the last sentence I would like to say is about the empirical analysis, which shows that people, unemployed smokers from lower income group, those living in the cities and those close to the border with Montenegro are more likely to evade taxes compared to the other groups. Different from the smokers smoking manufactured cigarette and living in the south of Albania. Thank you.
Thank you so much. This was a very good summary of your report. And unfortunately, there is so much more to actually read. So as I said, I'm inviting all the attendees after this presentation to check out the website and read the report, the details in the reports. So we are moving on to the presentation from North Macedonia. We are working with the think tank Analytica based in Skopje, and the presenter today is Natasha Trajkova-Najdovska, who will present the summary findings for North Macedonia.
Thank you, Violeta. I would like to thank to all for the research support and for the cooperation between the think tanks in the region. I mean, it's been an exciting topic for all of us, and we did cooperate a lot during this research. Here follow the results for North Macedonia. Well, North Macedonia, similarly, like other countries in the region, has very high smoking prevalence. Almost half of adults are actually currently using tobacco, and almost 80% of them started smoking before 25 years of age, relatively young. When we turn to the age groups, we can see that within the age group of 45 to 54 years of age, the percentage of smokers is the highest, 63.5%, while, which is encouraging, the percentage of smokers is lowest among the youngest group, 18 to 24, although it's still high compared to developed countries, but it's lowest within the country. Smoking prevalence is higher among men as compared to women, 58% among men and almost 40% among women. However, it should be noted that most of the smokers in North Macedonia are actually heavy smokers, smoking 20 cigarettes per day, more than 20 cigarettes per day. 45% of the smokers actually are smoking quite a lot during the day. And with respect to their efforts to stop smoking, only small percentage, almost 20% of current smokers have tried to quit smoking in the past 12 months, but they didn't manage to last long, their efforts. When it comes to the secondhand exposure, people in Macedonia, adults in North Macedonia, are exposed to secondhand smoke quite a lot, especially in bars and nightclubs and in the restaurants. When it comes to the price of the cigarettes, MC cigarettes are twice as expensive as hand-rolled tobacco. That is 1.73 euros versus almost €1 for 20 sticks of cigarettes. And average monthly spending for MC smokers, for manufactured cigarette smokers, is almost 31 euros per month. And for hand-rolled smokers is less than a half, 13.3 euros. Next slide, please. When we come to the illicit trade in tobacco and tobacco products, we can say that illicit trade, illicit cigarettes, the percentage of smokers who use illicit cigarettes is 12.4%. However, when we
about one minute.
If we consider the smoking intensity, then that percentage goes even to 15% almost. When we consider the avoidance of taxes, that is not a huge problem for North Macedonia because the percentage is quite low, 0.6% avoid taxes. However, the main problem with the tax evasion happens on the HR market, hand-rolled market, because HR smokers predominantly buy illicit tobacco. With tax evasion participating in the market with 86.7%. Here, most of the smokers purchase their cigarettes or their last pack on the green market, open air market without a tax stamp or without health warning labels at all. Well, we don't have this problem that much on the MC market where predominantly the purchases of cigarettes are domestically tax-paid purchases. So the main problem in North Macedonia with the illicit trade happens on the hand-rolled market.
Thank you, Natasha. So moving on to the presentation from Bosnia and Herzegovina, we are working with University of Banja Luka in Bosnia and Herzegovina, and our presenter today is Ljubiša Mišić. Ljubiša, please go ahead.
Hello, greetings to all. Thank you for the opportunity to present results for the Bosnia and Herzegovina. Let me start with the consumption. It is significant to notice that 41.1% of adults are current smokers. Among them, 3 in 4 are actually smokers of manufactured cigarettes. When we look at the data regarding the age of the consumers of consumers of tobacco, we see that almost half of the working population are actually smokers, which is important data for the future consideration. 42.9 daily smokers use more than 20 cigarettes per day, so they are considered as a heavy smokers. When we look at data regarding the start of the smoking process, we see that in age group between 18 and 24 years, there is a almost 60% of the smokers who started smoking at that age. It's important data for the future consideration of the policymakers regarding the prevention programs and similar tasks. When we add to the even younger population, this number even become higher than this one. When we talk about cessation, 12.2% of the smokers try to quit smoking. Among them, it is important to know that the majority of them tried it without any assistance or without any presence model or method of cessation. So almost everybody try to quit the smoking without any assistance. Among them, more than half managed to abstain less than a month. So it's usually like a short period of time without consumption of tobacco. And when we consider why they try to do it, 53% tried it because of the health reasons, and 37, which is quite a significant percentage, do it because of the price. So price is important thing in try to quit. 16.8% of ever smokers quit, so quit ratio is 16.8%. Among those who smoke less today than they do it in the past, only 10% of the smokers actually said that they smoke less. And when they analyze that, 58.7% of them reduced that smoking because of the health reasons. In Bosnia and Herzegovina, it is important to analyze the second-hand smoke exposure. It is heavy in home, working places, and also in public spaces. 4 in 5 adults living home where smoking is allowed. That's really high percentage of the exposure at home. And when we look at the public places, 9 of 10 bars, clubs, and restaurants, almost every has some kind of second-hand exposure. And 1/3 of the government buildings also had a noticeable presence of the second-hand smoke. When we see the economics or expenditure on the cigarettes, 7.3 of monthly income is spent on cigarettes. It's approximately 40 euros, so it's a relatively high amount of the money that is being spent on the cigarettes. And when we consider price that are being paid for the cigarettes, average price paid for the 20-stick MC pack is 2.5 euros, and almost 1.5 euro is for the hand-rolled cigarettes. The second thing that we analyze is actually illicit trade in Bosnia and Herzegovina. We made a difference between the percentage of the smokers who buy illicit and the percentage of the consumption in a matter of how much is illicit. So 35.3% of the smokers use evaded tax tobacco. And it is significantly different when we compare hand-rolled tobacco and MC tobacco. So age are hand-rolled tobacco smokers. In 93.3% buy tobacco that has evaded, so it's not paid tax on it, and 80.6% of MC smokers do the same. When we see thank you. So when we see consumption, its percentage is a little bit smaller, 30.3% of them. Regarding the criteria like place of purchase, health warning, and proper tax stamp, it's around 60 to 70% that is bought in illegal with appropriate health and tax stamp. So what is important for the Bosnia is that the municipalities that are closer to Serbia and Montenegro are those municipalities where we notice that there is a higher percentage of illicit cigarettes. It's mostly because of the price difference between the cigarettes in Bosnia and Herzegovina and Serbia and in Montenegro, because there is a cheaper cigarettes there, so people are preferring to buy those kind of illicit next to the borders. And when we analyze, for example, socio-demographic characteristics, we notice that less educated, younger, higher educated, younger smokers and those who live in larger households are less likely to evade. And when we introduced prevalence regarding the intensity of smoking, those who are heavier smoker does not to be use illicit cigarettes, because majority, like 53.3, is in the group which smoke between 10 and 20 cigarettes per day. Sorry for this fast presentation, but we are open for any additional questions. Thank you.
Sorry to you and all other presenters, because it's very easy to fill in 5 minutes with the information that you have. So the next presentation, the last but not least think tank presentation is from Serbia. With our partner think tank there is the Institute of Economic Sciences, and our presenter is Olivera Jovanovic. So please, Olivera, for yours.
Thank you, Violeta. Good afternoon, everyone. In behalf of the Institute of Economic Sciences, I will present you key findings for adult tobacco consumption and tobacco tax evasion and avoidance in Serbia. According to our research results, smoking prevalence for all tobacco products among adults in Serbia is 37.9%. Smoking prevalence for men is slightly higher compared to smoking prevalence for women. Manufactured cigarettes and hand-rolled tobacco are two most popular tobacco products in Serbia, because around 98% of all smokers use one or both types of tobacco products. According to our research results, prevalence for manufactured cigarettes is 32.8%, while prevalence for hand-rolled tobacco is 6.3%. Prevalence for heated tobacco products is 1.8%. When we compare prevalence by age groups, we can notice that almost every second adult in Serbia in the age between 35 and 65 years is a smoker. Also, it is very concerning that around every second adult in Serbia in the age, started to smoke daily in the ages between 18 and 24. Also, 6.3% of current smokers claim that they started to smoke daily in the age between 13 and 15. Regarding smoking cessation, only 9.5% of current smokers tried to quit smoking in the past year, and most of them, over 90%, tried to quit smoking without assistance. Price of cigarettes and health reasons are the most important factors for trying to quit smoking. Next slide, please. Secondhand smoke exposure is a very important topic in Serbia regarding tobacco control policies. And we ask respondents about secondhand smoke exposure at home, at public places, and at work. Secondhand smoke exposure at home is very high. At home is very high because every fifth adult in Serbia lives in homes where smoking is not allowed at all. Respondents said that they were exposed to tobacco smoke in public places, over 90% in bars and nightclubs, as well as in restaurants. The right side of the slide represents main findings for tobacco tax evasion in Serbia, where we can see that Serbian market of manufactured cigarettes is predominantly legal because 2.4% of MC market is considered as illicit. Hand-rolled tobacco market has an extremely high degree of tax evasion because 90.7% of consumption is considered as illicit. Illicit cigarette consumption in the overall represents around 15% of the tobacco market in total, which is considered manufactured cigarettes as well as hand-rolled tobacco. Below these findings, you can find several photos which we used in the analysis to identify illicit packs for manufactured cigarettes and for hand-rolled tobacco. More information about our key findings and results you can find in our reports, which is published on project website.
Thank you so much. So the next slide is actually provides the links to where you can read all the reports from our think tanks, these reports and previous studies that they've conducted as part of this project. So their project website is tobaccotaxation.org, or you can also find it on our website, which is linked to the project website. So I thank very much to all presenters, the think tank presenters. Apologies again for such a short period of time allowed for their presentations, but I hope they understand. So now we are moving to the next presentation where Dr. Frank Chaloupka will summarize the findings from the Tobacconomics Cigarette Tax Scorecard.
Great, thanks Violetta, and thanks to all the presenters. I'm going to briefly highlight some of the findings from the Cigarette Tax Scorecard. We jumped ahead. This is an effort that we undertook over the last about year and a half at the University of Illinois in Chicago, really trying to assess how countries are doing with their cigarette tax systems. So we have extensive evidence that shows how effective taxes are, how effective prices are in reducing tobacco use. But one of the things that we've learned over the years is that there are different ways of taxing cigarettes that are going to improve the effectiveness of these taxes, both in terms of their health impacts as well as in terms of revenue generation. So the next slide highlights the factors that we focus on in the scorecard. We have, as Sharon pointed out, as others have pointed out, in the presentations, extensive evidence from every part of the world that shows that increases in cigarette prices are very effective in reducing overall cigarette smoking and reducing how many cigarette smokers consume. But we've also learned over time that it's not just enough to increase prices. Prices have to be increasing fast enough to reduce the affordability of cigarettes. So in countries where incomes are growing very rapidly, prices need to rise faster than incomes in order to reduce affordability and reduce consumption. So in the scorecard, we try to factor in this evidence on the impact of prices, on the impact of affordability, in terms of assessing how well tax and price are doing in reducing tobacco use. The one factor that's been highlighted frequently over the years is the idea that taxes should be a relatively high share of prices. This is something that first appeared back in the World Bank's Curbing the Epidemic report over 20 years ago, something that's been continually re-emphasized over time, with the basic idea here being that as taxes go up as a share of price, that's going to be increasing prices relatively rapidly. And then the last thing that we've learned is that cigarette tax structures are going to be important. It's not just enough to raise taxes, it's also important to have very efficient, very simple cigarette tax structures that apply similarly across all cigarettes and that are regularly adjusted in order to reduce the impacts of income growth and inflation. So the next slide, please. Here we highlight some of the data in the scorecard. Most of the information that we get comes from the WHO's reports that they do every 2 years, looking at the implementation of tobacco control policies globally. But in particular, we're focusing on the data that they collect that relates to cigarette prices, cigarette taxes, cigarette tax structures, and so on. They've been doing this for 10 years at this point, or for over 10 years at this point. So we use the data that they collect to develop scores for 2018, 2016, and 2014. This is an effort that has gone through extensive peer review, and it really is derived from the recommendations and the guidance that we get from a number of different sources. So we emphasize the information that comes, for example, out of the guidelines for implementation of Article 6 of the Framework Convention on Tobacco Control, emphasize some of the recommendations that come from WHO, from the World Bank, as well as really taking account of the extensive empirical evidence that we have globally. Next slide, please. So again, we've gone ahead and looked at these data, developed scores. We use an overall 5-point scoring scale for each of the individual 4 components of the scorecard. And then we average those 5 components to come up with our overall scores. So scores can range from 0 to 5. And on the next slide, we can see that there is considerable variation if we look around the world in terms of the scores that countries get. So the darker a country is on this map, the better they're doing, the higher their score is in our scorecard. The lighter they are, the more poorly they're doing. And then those countries that are tan in the coloring here are countries that we don't have data for. So next slide. Again, if we look at what's going on globally, we can see that there is considerable variation, but I think the key takeaway here is that countries are not doing very well when it comes to their cigarette tax systems. So again, there's a 5-point potential score on this. On average, countries are getting just over 2 out of the 5 points. And what we can see is again, there's going to be variability regionally. In Europe, for example, scores are higher on average, just over half of that potential 5 points, partly because of some of the strong standards that are implemented in the European Union's Tobacco Tax Directive. We can see in the Americas and the Western Pacific, they're doing somewhat worse. And then scores are lowest on average in Africa. We see a consistent relationship with income. Low-income countries are the ones that are doing most poorly. But again, even as income increases, we see scores going up, but still well below the potential based on the scoring system that we've developed. Next slide. There are a few countries that are doing relatively well. The countries that score best on our metric is Australia and New Zealand. These are countries that have among the highest prices in the world. They have very good tax structures, uniform specific tax systems. Taxes are regularly adjusted to account for income growth or inflation. Taxes have been increased steadily over the years, extra normal tax increases on top of those adjustments for income or inflation that have reduced affordability. And as a result, they're scoring very, very well relative to most of the rest of the countries in the world. Next slide. If we look at this region, we see that on average, the region is doing better than what we see globally, but still, again, a lot of room for improvements in the countries in the region. So we could see that here, Montenegro is doing the best in terms of our metrics. Montenegro has done a good job of raising taxes in order to reduce the affordability of cigarettes over time. The share of tax is relatively high. But there is some room for improvement. Cigarette prices are still somewhat low, and tax structure could be improved significantly. In Bosnia and Herzegovina and Serbia, we see that they come in tied for second in the region. Again, doing relatively well on some of the metrics in terms of reducing affordability, for example. But we still see, again, places where there could be significant improvements. There could be improvements to tax structure in both countries. And you can see in both prices are relatively low, and that's particularly true in Serbia. At the other end, we see Albania and North Macedonia not doing very well overall, in large part because they have not increased taxes over the last several years in a way that's reduced the affordability significantly in their countries. They're getting 0 points on our metric for affordability, which says that either cigarettes have become more affordable or there's been no reduction in the affordability of cigarettes in those countries. Again, both have prices that are relatively low compared to most of the countries in the region, and that's particularly true in North Macedonia. Next slide shows that there has been some evolution over time. Some countries are doing better. Some countries have gone backwards, unfortunately. So we see North Macedonia, for example, has seen some improvements over time. Same thing has been true in Montenegro, but what we see on the other side is that countries, Albania in particular, have seen their scores going down over time, partly again as a result of the lack of improvements in affordability. So next slide. Just to summarize all this, let's jump to the next one.
Frank, we cannot hear you. Frank, sorry, we cannot hear you. It looks like something is going on with the connection, Frank's connection. So looks like he cannot hear us as well. So he's smiling, so probably he knows that I'm telling him that, yeah. So something happened with the connection. For some reason, we cannot hear Frank anymore. Okay, so thanks so much, Frank. Sorry for this. Not sure what happened, but I'd like to open now Q&A session. We already answered some questions in the that were already shared. I'd like to ask all the presenters to turn their cameras on. So some questions already have been shared and we've been answering throughout the presentations. For example, one of the first questions was whether we have any data, similar data from, for example, Greece or Cyprus. No, our project is only in low and middle income countries. So in this particular case, these are only data from these 6 countries that through which we went, through which presentations we went today. And fortunately, Greece and Cyprus cannot qualify for our research, sadly, at least this one. Also, there was a question that was shared on hand-rolled tobacco, where the tobacco comes from. And maybe Natasha and Besnik have already responded to this question. Maybe they would also like to share with the wider audience, provide a response to all the interested attendees rather than me reading their responses.
Yeah, I can do that if Natasha is still not connected. So as I said on this message, I responded. So basically the hand-rolled tobacco in Kosovo mainly comes from these private farmers who farm tobacco for private use, because according to our regulations and our laws, tobacco actually is not farmed anymore in Kosovo, and most of the tobacco that is smoked here comes from abroad. So then when we asked the tobacco consumers whether these products that they consume contain all these criteria, which we considered determine whether a pack is legal or illegal, most of them didn't contain those, such as tax stamp, health warning label, or the place of purchase. And this basically explains that also, since there is a very small percentage of tobacco smokers or hand-rolled tobacco smokers in Kosovo, the state, I guess, is also not interested in chasing these sellers and forcing them to get a license for selling such products in open air markets. I don't know if this answers the question.
Thank you.
But yeah, thank you.
Natasha, were you trying to say something, or?
I think that summarizes the situation in the region altogether. I mean, partly comes from domestic production, and partly it comes from the illicit trade within the region, or maybe imported from other countries, from Turkey or somewhere. But we cannot make a strong statement about it because most of it came packed in the cloth, in big ballas. We call them big ballas, cloth material. So you cannot make conclusion where is the origin of the big balla. I mean, with the survey instrument.
Oh, yes, thank you. So there was one question asking about whether the survey included new products. Yes, the smokers were also asked about new products, given that percentage of smokers who actually use new products in this region is very small. That's why the presentations didn't include the statistics. However, you can read about those in the reports. Probably only in Serbia, it's close to 2%. In all other countries, it's below 2% of smokers use, adults use new products. There's a question about the scorecard. Have the scorecards been presented to the ministries of finance, and what has been their reaction? So maybe Frank can answer this.
Hi, everyone. Sorry, I got cut off there in the end of my presentation. But part of what we're trying to do to present the scorecard is to go through events like this. So we've been able to give some presentations in some global forums, and we're doing more of these regional sorts of meetings as well. Ideally hoping to present it to ministries of finance, ministries of health, other tax policymakers. So we haven't gotten a lot of reactions yet. If there's anybody from a Ministry of Finance on the call today, I'd love to hear what you think about it. But it is something that we are trying to do, and we'll hopefully be getting feedback and improve this as we plan to release the next version of it later this year.
It says we're 1,000 smokers surveyed in all 5 countries. So there was 2,000 in Serbia and 5,000, so 1,000 each of 5 countries, in total 7,000 no smokers, but adults. So 7,000 adults were surveyed in these 6 surveys. It says, in the countries covered in the study, how are the seized illicit products disposed of, destroyed, or resolved by governments? That's a question for individual team members. What happens with the illicit products when they are seized by the government officials? Anyone from the team? I'm sure the policies are very similar in the region, so maybe someone can just, whoever is, Besnik, yes, you are volunteering.
Yeah, in Kosovo, usually they destroy it. So they send it to the electricity corporation, and they put it on these ovens, so they burn it completely out. This is what they usually do with it.
There was thank you, Besnik. There was also a question about what I mentioned at the beginning, that most estimates on prevalence among adults before this survey in these countries, of course, was based on the household budget survey. And I said that, of course, these estimates have many limitations. And in this comment actually agrees with that, and asking about whether if similar survey was conducted in most of the world, in other countries, whether the figures obtained from such survey would be different from health surveys. That depends. Depends on how the survey, I mean, of course, the design of the survey, whether it's national representative, depending on what kind of questions are asked. It should not be, because it is individual level if similar questions are asked, but maybe Frank has something to say about it, given he has a lot of experience on conducting these surveys.
No, I think your answer is accurate, Violetta. You know, the design of the survey is going to tell you something about the quality of the data that you get out. What we did here was to design a nationally representative survey that would produce good measures of tobacco use prevalence, which I think would be comparable to other nationally representative surveys that were well designed as well.
Thank you. So we are right on time, scheduled 60 minutes. So it's 9 a.m. here in Chicago. So I would like to thank everyone, presenters, for contributing to with their presentations today, and apologies again for such a tight schedule, all attendees for joining the presentation. As I said, there are some questions left in the box, so we'll try to answer them over email as we have your registration details. I'd like to ask if Margaret, can you just go to the last slide? If for all the details on the reports, you can check our website, tobacconomics.org, and you can find all the reports, fact sheets, policy briefs, as well as previous reports, also the scorecard. So for all details, you can check our website, or you can email us with any questions. So thank you very much again, very much appreciated. And for the next event, we will keep you updated, inform you, and we hope to see you soon again in our next webinar.